Hi, I'm Joe Calderoni. I'm the Senior Vice President for Communications here at Mount Sinai, South Nassau. Thank you for joining us for this live Facebook broadcast. We're doing an update on COVID-19. We're very pleased today to have Dr. Aaron Glatt. Dr. Glatt is the chairman of the Department of Medicine here at Mount Sinai, South Nassau. He's also a national spokesperson for the Infectious Disease Society of America, and he is our hospital epidemiologist. He is a disease detective, and he's been doing this virtually for his entire career, and he's devoted his life to it, really. So we're very grateful that you're able to take a few moments and speak with our live audience. There's a lot of questions out there. People are at home. They're off from work or they're working from home. Their children are at home with them in some cases. So we just wanted to try to provide them with some relevant, useful, timely information. One question that we're getting a lot, I'm at home, I've got the sniffles, I have a cough, maybe I have a little sore throat. Do I have COVID-19? Should I go get tested? What should I do?
So this is a very important question, and it's a pleasure to be here with you today, Joe. We want to give the best information that we have always to the community, and this is a rapidly changing field. The information we're providing today is the best of our information, possibly true. Things change, so everybody has to keep that in mind. Right now, if a person has some viral symptoms, they have a little bit of a cold, a little bit of a cough, maybe a little bit of a fever, statistically today, it still is probably not COVID. There are still lots of influenza cases out there. We've actually identified many new influenza cases because we're doing so much more testing now than in the previous month. There are lots of cold viruses out there, rhinoviruses, and all sorts of other viruses that can mimic some of the symptoms of COVID. So the first and most important thing for a person to do if they have symptoms is to assess themselves how sick they are. And if they're otherwise healthy, if they don't have underlying significant medical problems, they probably don't need to do anything right then and there. They should contact their physician on the telephone if they have any concerns. If they're not having difficulty breathing, if they're not having a physical state that requires them under other circumstances to go to the emergency room, please don't go to the emergency room because the emergency rooms are overwhelmed. And therefore, we want to make sure everybody gets care in the appropriate place. So if you have what you normally would have called for yourself a mild cold, you absolutely should not leave your house. You should self-quarantine yourself. Try to stay away from even your own family as much as possible. But if you're feeling pretty good otherwise, we don't recommend that you get tested at that point in time. We don't recommend that you get seen by a physician at that point in time. But we absolutely recommend that you not go near other people. You certainly shouldn't be going out of your house. You certainly shouldn't be going to work. You shouldn't be going to any sort of a recreational event. You should stay home, self-quarantine.
Now, what if I have a fever? I got a cough, I got some runny nose maybe, but I also have a fever. Does that up the ante?
So it makes, obviously, us concerned that you have a more serious type of a viral infection, such as COVID or influenza. But absolutely, if you're otherwise feeling okay, everything that I just said before doesn't change. If everybody who has a little bit of a cold, a fever, started to go and demand COVID testing, we don't have the resources anywhere in this state right now to handle that. As we develop more and more resources with the opening of Jones Beach for this drive-by testing, as more and more urgent care centers have the ability to do COVID testing, so then it might be more important to identify people. But practically speaking, even if you know that you're COVID positive and you have mild disease, thank God, stay home.
So
don't go out.
What's the trigger when I really say, oh boy, I either need to go to the emergency room or I really think I need to get tested? What is the trigger? Difficulty breathing?
Absolutely. Anybody who would have thought to go to their doctor's office based upon their symptoms should certainly call that office up first and let them know that they're coming in. Call the urgent care center, let them know you're coming in so they can prepare for you, put a mask on you, bring you into an isolation room so you don't potentially transmit it to anybody else in the waiting room or to the staff. And if, heaven forbid, you're sick enough that you would have gone to the emergency room beforehand because of your symptoms, absolutely go now. Let the emergency medical staff to come to take care of you, the 911 people, the fire department, whoever it is that's coming to transport you, let them know what your symptoms are, that you think you might have COVID. And this way they can also protect themselves and their families and transport you safely and promptly. And the emergency room will know that you're coming in and they can isolate you right away.
So as always, if it's a real emergency, if you're having trouble breathing, call 911
Absolutely.
is your best advice.
Absolutely. And don't play any games. If you're debating about calling 911, you probably should. But if you know you don't need emergency room care, you've had a cold in the past, this is no different. Stay home.
All right. We've heard a lot, even at the White House level, we've heard a lot about new efforts to open up more telemedicine avenues so that people who maybe are at home and they have mild symptoms, but they're a little worried, the worried well, as they're called. What about telemedicine? Or is that a good thing to use?
So telemedicine is a wonderful thing, and it should be and can be used oftentimes instead of going to the doctor's office, especially if it doesn't look like the doctor's office, the physician, is going to be able to really help you. If somebody has a virus, with some exceptions, there are very few things that we can do for them. There is a treatment for the flu, which may or may not be indicated. There is no treatment currently for COVID. There are experimental therapies that we at our hospital are beginning to start using, and other hospitals as well. But if there is no therapy for you, then going to the doctor to get the diagnosis or to say, I think you may or may not have this illness, sometimes that could be accomplished through telemedicine or even a phone call. It doesn't have to be fancy telemedicine. You can describe to your doctor, especially if the doctor knows you, what your symptoms are. He knows your general background. He knows the medications and illnesses that you have, and can say, I don't think you need to do anything right now. Call me back tomorrow. If things change, you have to revisit it.
Okay, so call your doctor is the answer, but telemedicine is good. Mount Sinai, I got to put a little plug in here. Mount Sinai does have a telemedicine app called Mount Sinai Now, I believe it's called, and certainly we're urging our patients and people in our community to consider using that as one way to get information and to possibly get a diagnosis over the phone.
Okay. And just one other point. You don't have to call your doctor if you know that you just have a mild set of symptoms. The physician's offices are also being overwhelmed, and we don't want them to just take a call from somebody who's going to tell them, I feel okay, but I have a little cough, I have a low-grade temperature, what should I do? And they're going to say, stay home. So if you know that that's going to be the answer, if you wouldn't have gone to seek out a doctor last year with the same exact set of symptoms, the same exact illnesses and medications that you're on, you probably shouldn't do that right now, assuming you have mild disease.
Now, I just want to clarify one point you made. There is no cure for COVID-19, but if you have severe symptoms and you're having difficulty breathing, once you get to the hospital, if you are diagnosed with COVID-19 and you're having great difficulty, I mean, there are some therapies that we're using.
Absolutely. We can do a lot for somebody to help them get through their COVID-19 illness. Hopefully their bodies will be able to eventually respond. So we do have lots of things that we can do to assist in breathing. We can give oxygen. We can do more aggressive types of therapies to help with the breathing. Heaven forbid, if somebody needs it, they can be placed on a respirator. We can, what we call, intubate them, put a tube down their throat, and breathe for them until their lungs are hopefully recovering and they can start breathing for themselves. And this happens all the time. Unfortunately, we don't have a specific medication yet that we can say, take this pill and you'll be fine.
But if you're having trouble, don't say, oh, there's no cure for this anyway, I'm going to stay home and tough it out.
Certainly.
If you're having trouble, we can help you.
Absolutely.
Okay. All right. Now, you mentioned Jones Beach testing. I just want to go back to that a little bit. What is the point of everybody going to Jones Beach to have a COVID-19 test, and can anyone go there?
Okay. So it is very important. One of the things that has hampered our ability to both identify patients get them to better self-isolate, self-quarantine, has been we haven't been able to easily identify who has COVID-19 and who has something else. Now, anybody with symptoms shouldn't be going around anyway. That's been always the advice that we've given. But certainly since COVID-19 is potentially a very serious problem, especially for people above the age of 50, 60, and certainly in people in the 70s and 80s, so therefore we'd like to identify people and tell them, you definitely have COVID-19, you definitely need to self-quarantine, no questions asked. Sometimes when we tell people self-quarantine but we don't have a diagnosis, I feel better, I'm going out, I'm going to go shopping, I'm going to go to the mall, I'm going to go to the movies.
So it's important to get that confirmation, especially if you're potentially vulnerable.
Right, so confirmation is very important. The turnaround time for these tests is unfortunately much more than any of us would like. Mount Sinai, however, now has the ability to do a rapid test. We are hopefully starting that today at Mount Sinai South Nassau, and we'll have hopefully much better turnaround times. We've had turnaround times that have been between 4 and 6 days. The specimens were sent to North Carolina. There are very few places in the country that have been able to do this testing. 2 weeks ago, the CDC was the only place in the country that could do the testing. 1 week ago, only certain state laboratories could do the testing. And then commercial laboratories like LabCorp and Quest were able to do the testing. But the turnaround times have been holding us back. But the turnaround times at those laboratories are improving, and with some more rapid technologies, we're hoping to have maybe same day, at most, the next day turnaround time starting to go forward.
So I just want to follow up real quick on Jones Beach. Do you need a prescription to go to Jones Beach?
You do not need a prescription. A person can drive over there. There are some requirements. They won't just test asymptomatic people. We do not recommend. This is a very important
If you have no
point.
symptoms.
If somebody has no symptoms, they've been exposed to somebody,
Or they think they've been
or
exposed.
they think they've been exposed to somebody, there is no testing recommended. We do not suggest that you get tested. We, in fact, suggest that you not get tested. Even if the test is negative, it doesn't mean you don't have it. And there are people that could be symptomatic carriers. That's one of Achilles' heels in this. That's a problem, that a person could be perfectly healthy and still potentially transmit disease in a small percentage of patients. We don't know exactly how small, but it's probably a real number, maybe 5 to 10%. And this is why this disease has been spreading so much more. Whenever we see positives, we always assume that there's a whole bunch of people that aren't positive that are out there potentially transmitting disease.
So just to finish up on Jones Beach, I believe you have to call an 888 number first, try to make an appointment. You don't need a prescription, but I think they want you to have an appointment.
So I defer to that. I was under the understanding that you could actually drive over there and they would take people, but only after they screened them did they meet certain criteria. You can certainly call up and get an appointment. That is absolutely true.
Okay. All right, and of course you can also go to the New York State Department of Health website for more information.
Right. All of this information there, including the 1-888 number, is something that people should have available, and they shouldn't hesitate to call it. They should realize there may be long wait times because a lot of other people are calling it as well.
I know that you have really, in your spare time, not that you have much spare time these days, but you've been studying any of the papers, the academic papers that have come out on what's happened in China, Italy, and Washington State out west. We've heard predictions from the state that the peak of this spread of COVID-19 is 45 days away, which of course means after it peaks, then there's another valley after that. Is that, you think that's accurate? What is your best estimate?
So that 45-day number is based upon the current spread and the predicted continued spread based upon us not intervening or doing something about it. And yes, that's a very scary number, that we haven't come anywhere near the peak yet, and it's going to be continuously rising in the number of cases. And unfortunately, every day that is coming true. And that's why I want to stress the single most important thing that everybody can do is to really understand what social distancing means. That's the buzzword of 2020. That'll be the word of the year. What it means is
we're 6 feet
we are
apart
6 feet apart
for
at
a
least,
reason,
and we
not
shouldn't.
because I don't like you.
And we shouldn't be doing this unless there is a very good reason. For disseminating public health information, this is appropriate. But for us to sit here and have a coffee together like this would not have been appropriate. And people need to change their habits. As of a week or 2 or 3, nobody was really practicing social distancing. Now many people are, but not enough. That means not going to the gym. Go jog outside. That's safe. That's okay. Just don't stop and shake people's hands.
A lot of the gyms are closed now.
Right. Well, that's the whole point.
Restaurants are closed.
That's the whole point. We need to be aggressive about this. Don't go to social recreational settings that involve other people.
But what do you say to people, though? There's some people still say, this is overreaction. It's overblown. We hear about trying to flatten the curve. Yeah. Dr. Fauci from NIH talks about that. But is it overblown?
So anybody who thinks it's overblown should go visit their local hospital and see how many beds are currently being occupied by patients who are either confirmed with COVID or having COVID ruled out. We've created new units in this hospital to expand our bed capacity. So have other hospitals. In Seattle, that system's been overwhelmed. In Italy and other European countries, those systems have been overwhelmed. This is not fake news. This is not something that anybody can ignore or dismiss. This is a serious medical health care crisis that we have faced. Probably back in 1919 when you had the Spanish flu that killed worldwide 50 to 100 million people is as close to comparing the potential disaster that we could be having now with COVID-19.
So the steps we're taking now really are going to make a difference. It is going to be important. The social isolating.
If everybody takes these steps, if half the people take these steps, it's going to be a problem. But if 100% of the people recognize this seriousness of this potential problem and they follow through and not say, well, it's legal to have 50 people gathering. It's legal to open my business still.
I think we're down to 10.
Well, these are recommendations.
Right.
It's legal still to have 50. We need to cut that. We really need to tell everybody a meeting of 2 people is not appropriate unless it's essential. In the hospital, we're an essential service. A pharmacy is an essential service. Supermarkets are essential services. People need to be able to get food. But when you go to these places, in and out, you try to make 1 trip instead of 5 small trips. You call ahead where you can and have your prescription ready for you so you can just pick it up and leave. You should wash your hands when you leave that place. You should try to distance yourself. People should be packed on a line in a pharmacy, packed on a line in a supermarket. There should be social distancing there. People need not to shake other people's hands, not to embrace other people. These are normal activities of life that show our collegiality and congeniality with other people. That has to change.
So all of these extreme measures, and it could go on for another 45 days or more. We're talking, weeks, months. You're saying that it's really our civic duty to each other to take these measures now to try to reduce the spread of this disease, which can be deadly.
Absolutely. And I would stress, it's your civic duty to yourself, to your family, but especially to the grandparents and the great-grandparents. They are the ones that are most at risk. I want to tell you 2 studies. One was just published, one is already an old study from a week ago. Study just published, which is at least the best news I could possibly give you. They looked at the experience in China in children. And thank God, the best news I can say over here and disseminate to everybody is that there was no deaths in children under 10. And the vast majority, 90% of those children were either asymptomatic, no symptoms, very mild symptoms, and that some of them had moderate symptoms, but the kids all got better. There was unfortunately 1 death in a 14-year-old boy. But other than that, children and adolescents seem to be extremely capable of handling this illness. The bad news is a study that was just published from the Italy experience, and that is that since there's a tremendous amount of intergenerational interaction in Italy, they have a large older grandparent, great-grandparent population that interacts with their children and grandchildren. So they have had a severe problem in their older population. Don't ask me how to define older. So the data suggests people above 80 who get COVID are much more at risk. And that's why it's essential. I feel terrible saying this as a grandparent myself. Kids and grandparents need to separate.
For this
Talk to them on
period.
FaceTime.
Right.
WhatsApp them. Call them on the phone. That's critical. Don't leave those grandparents missing their grandchildren. But don't visit them.
In recent days, though, we've even heard that among the 20 to 30, even 40, that they're not immune.
Absolutely. We've had serious cases in younger people as well. So adolescents, and certainly in the grade school age children, thank God they seem to get very mild disease. There are always exceptions possibly there too. Once you start hitting adulthood, so every generation, every decade going up, puts you at slightly more risk. Not to worry people, I'm 35, is that more than 32? We don't want to drive people crazy, but yes, you can get serious disease even in younger people, but once you start
and we've
hitting...
seen it. We've seen cases.
We have seen it.
Okay.
Well, once you start hitting 50 and 60, that's when you're going to see a lot more hospitalizations. That's when you're going to see a lot more people already on ventilators. And when you go above that to the 70 and 80-year-old group, you're unfortunately going to see it even more. And unfortunately, those are the patients that have the highest mortality.
So this is a good segue to the issue of what hospitals are doing to get ready for the surge. I know here at Mount Sinai South Nassau, over the weekend, we converted some space in one of the units that had been used for an oncology infusion center. We moved that to a conference room in order to create roughly about 40 more beds. Our medical residents are now sleeping in a conference room adjacent to this conference room. This conference room, by the way, if you see boxes behind Dr. Glatt, it's because this conference room is being converted into a storage area. So we're making a lot of moves to create additional bed space. But just talk a little bit about what we're doing here to get ready for the surge.
Sure. So kudos to the staff. In an unbelievable short period of time, they efficiently and very safely transferred what was previously a beautiful infusion unit and turned it back into being a patient care unit, and took a nice conference room and transformed it over the weekend into an up and running on Monday morning infusion center. And this was, again, kudos to the staff at the hospital.
And the purpose of that was to create bed space.
But that created an entire additional unit for care of patients, and it could theoretically be twice that capacity if we put two people in a room. You can put a COVID positive patient in a room with another COVID positive patient. We can't do that when they're unconfirmed or rule outs, because you could be putting somebody who doesn't have the disease in a room with somebody who does have the disease. So we're trying to maximize our capacity. We're moving things around in the hospital to increase beds. We've stopped elective surgery. All hospitals are stopping elective surgery to allow the ORs to be used theoretically as additional intensive care beds. The OR machinery can be additional respirators,
including vents.
ventilators.
The vents in the
the
ORs,
respirators,
I think
the
there's about
ventilators
20
can be used.
that could be freed up.
This increases significantly the capacity to take care of what, unfortunately, we have to prepare for would be an onslaught of probably older patients with significant lung disease and lung compromise that we have to breathe for them.
All right, I just want to switch back to the folks who are at home. Some of them, again, are working from home. Others are with their children at home. It's nice to be with your family, but if you're there for long periods of time and you're not going out a lot, it can get a little nutty. So what do you recommend to folks to just try to keep their mental health in shape during this crisis?
So one of the best things to do is to go outside. Social
Take a walk.
distancing doesn't mean staying in your bedroom, closing the windows and wearing a mask. Social distancing means when you're taking a walk, wave to the people across the street and don't stop and shake their hands and talk to them for 10 minutes. But it means getting out. The close family, they're exposed to each other inside. They can hold hands and walk next to each other outside. That's not a problem. The kids can play in their yard. The kids can play by themselves. The same family unit has absolutely no concerns. They're inside. They can certainly be outside together. Get fresh air. Jog. That's very important for mental health.
Okay, good. Now what about, we've all seen a lot of hoarding of some basic supplies and food. Is that really necessary?
To the best of my knowledge, in speaking with numerous public officials and speaking with numerous businesses in the community, there is no expectation that there will be food shortages. So, yeah, you should have a supply of food on your hand in case you get sick and you can't go outside. But that doesn't mean that you have to have the supply until the end of the year. It means that you should have a reasonable amount of food in your house, a reasonable amount of the disposable products in your house, probably what you should have all the time.
2 weeks supply.
A reasonable supply. But to have stacks and stacks and stacks of paper goods and toilet products, there is no reason for people to do that. And when you do have runs on a product, so then it causes a panic.
Right,
and
right.
The stores need to appropriately distribute
that, right.
all of their products. And when there's a run on something and they're empty shelves for no reason, so it causes a panic in the public, and it's not good for the stores. They can't function in that way.
All right, so stay calm, stay calm.
The most important message is we will get through this. We're going to have a lot of pain and suffering, but we're going to get through this, and everybody has to realize they have their part to play in getting through with it. Most people, that's social distancing. For most of us in the hospital world, it means that we're going to spend long hours and put ourselves at risk to a certain extent. Wearing protective personal equipment is appropriate, but we need to have that equipment. So people need to not hoard and buy masks and buy all sorts of other things that hospitals need.
All right, I want to get to some questions from our Facebook audience now. We appreciate very much you tuning in, and we have been reading your questions. Keep sending them in on the feed. We're going to try to get to as many of them as we possibly can. One that we've gotten that I think people have been asking recently, if I do have a fever, Tylenol or Advil?
Okay. So this is the great debate that's going on right now. I will tell you what the facts are, and then I will tell you my opinion. The facts are that the French public health minister made a public statement saying his opinion was that you shouldn't use what we call the non-steroidals, the Motrin, Advil type of drugs, and instead should use Tylenol. What was that based upon? That was based upon a doctor who had 4 young patients who had COVID, and those patients did poorly. And a common denominator amongst those patients were that they all had taken some of these non-steroidal drugs. To my knowledge, that is the only information that's been disseminated about this potential concern. In speaking with many of my other colleagues in infectious diseases, that would certainly not be enough of a reason for me to recommend somebody not using a non-steroidal agent like a Motrin or an Advil and insisting that you use Tylenol. So at this point in time, based upon the current published information, we always try to stay away from using non-steroidals in certain conditions because they can impact the kidney, they can do impacts on other parts of the body. So we don't like to use these drugs inappropriately, but we don't hesitate to use them in the appropriate patient population. At this point in time, if somebody's not feeling well and they have one of these non-steroidal agents in their house and it will give them some symptom relief, I do not recommend at this point that they change and say, no, I must use Tylenol.
Okay. So Advil you think is still safe?
At this point in time, based upon what's published.
Okay.
It's again, the reasons why this has made such a big internet is based upon the information that I told you. One doctor with 4 cases, which can't be ignored, but it needs to be assessed and evaluated. There is no information on what was unique.
No scientific study.
What was unique about those patients, so I can't really make a comment on it.
Okay. Let's take another question from Heidi. She says, if you have cold symptoms, but you're unsure it's COVID-19, can you still cook and care for others like your children and your family?
Yes, you should practice the appropriate measures. This has nothing to do with COVID. Anybody sick really shouldn't be handling food. You should try to have somebody else in the household do that. But if you're a single mother taking care of children and the children need you to cook for them, so you should certainly wash your hands well. You should obviously try not to cough, sneeze on anywhere near the food. If you do, wash your hands well again. Food is cooked. That should probably help in some way, but I'm not recommending that somebody who is sick should ever be preparing food or handling food.
That's just in general.
That's in general, nothing to do with COVID. We don't want people to get other foodborne illnesses. They should never be preparing food if you're sick unless there is absolutely no alternative. Young children need a mother
And
to
of course,
prepare food.
wash your hands,
Wash your hands. Yes.
wash your hands.
And certainly, if you need to cough or sneeze, don't do it anywhere near the food, and then wash your hands right afterwards. Try to do it into a tissue. Go away from the food, sneeze or cough into the tissue, throw the tissue in the garbage, wash your hands again.
Soap and water.
Good old soap and water works wonderfully.
Okay. We have another
For 20
question.
seconds, at least 20
seconds. Sing happy birthday
if you want.
while you're washing your hands. We have another question. Can you take antibiotics if you have COVID-19?
So-
COVID-19 is a virus.
Right. So let me answer that question the right way. Antibiotics will do absolutely nothing for COVID. Antivirals that we treat the flu with, like Tamiflu, will do nothing for COVID. So absolutely do not take antibiotics or other antivirals in your house that you may have in pills to treat COVID. It will not work. It can only hurt you. It will not help you. But if somebody has a urine infection and their doctor tells them to take an antibiotic,
For another reason. They're on
and
antibiotics
even if
for
they have
another reason.
COVID, there's nothing wrong appropriately taking an antibiotic. It won't interact with the COVID. So if you have to take a medication because your doctor prescribed it and you happen to also have symptoms or confirmed COVID, your doctor would obviously hopefully know that information and can decide which is a good drug or medication for you to take, which is not. But in general, they wouldn't interact with the COVID.
And of course, if you're unsure, check with your physician.
Absolutely. You shouldn't be taking any prescription medicine ever without checking with your physician, even if you happen to have it in your medicine chest.
Okay, we got another question from Lisa. If you can be asymptomatic and be a carrier, why is there no mandatory quarantine yet? Why aren't we sheltering in place?
So that's a very, very good question. And maybe at some point in the future, that may be necessary. I don't have an answer for that. I strongly recommend that everybody should be self-isolating themselves and have essentially no social contact that's not essential. But there's a difference between saying nobody goes out, we're shutting down, and saying practice extreme social distancing, but allowing people to go out for a walk, and at this point in time, until delivery systems can be set up, still going to a pharmacy or to a supermarket. When you mandate people can't leave their houses, you also have to have a way to deliver to them essentials.
And so far, our civil authorities, the governor's office, they have decided not to impose a total quarantine lockdown.
Correct.
Right?
But again, nobody should misunderstand that. And nobody should think that it's okay to do whatever you want to do. The governor has not yet declared that we're on a mandatory self-quarantine. But everybody should be on a voluntary, mandatory social distancing.
Okay. We have Leonard is asking, which I know you've been asked this before, very common question. The masks, the wearing of the masks. When should I wear a mask? In what instances should I wear a mask? And what's the difference between the N95 mask that we hear so much about and the regular surgical mask?
Okay, so one general statement. We don't really know if there are enough masks available for everybody to wear masks. And that's a very important factor. If we make a recommendation that people should do something and it's not available, A, it's going to cause panic, and B, it's going to cause runs. And any product that's available will be hoarded by people. The current recommendations from the CDC, and again, I want to stress, everything is in a changing environment. Let's talk about the hospital where we have hard, solid data. The only time in a hospital taking care of a COVID-confirmed case that you should be wearing an N95 is during certain procedures that cause aerosolization. That's a fancy word of saying that it causes the virus to get dispersed more in the environment when we do certain medical procedures on them or certain treatment procedures on them. In that situation, the workers should be wearing what we call special droplet precautions, which means that you wear a mask, an N95 mask, with a face shield.
This is the personal protective equipment
for
healthcare workers.
Healthcare workers
Right.
in the hospital, and only on very specific COVID-19 patients, not on all COVID-19 patients, because those are the highest risk situations when they're doing a procedure on
But
them.
if I'm home,
So we'll get to that. In the hospital, we wear a regular surgical face mask, and we wear it during the entire day while you're in a patient care area. That's to protect the patients as much as it is to protect the doctor, because of potential, when you're perfectly well, you might still, in a small percentage of people, be shedding virus. So to protect our patients, the doctors wear a mask. In the outside world, if a person is sick, they shouldn't be around other people. But if they have to be around other people, they're going to their doctor, they're having difficulty breathing, they need to be seen by their doctor for whatever medical problem, they should wear a mask in that situation.
or even inside the house, if I don't want to get my spouse sick?
So
or-
if they're around, we try to tell the spouses they ideally should be separate. If you want to transmit it to your spouse, if you don't particularly like your spouse, then be in close contact with them a lot.
Right.
But that probably was a problem if they didn't like their spouse. If you like your spouse, try to stay away from them if you're sick. You should be in one room, or at least have a zone around you of 6 feet.
Right.
And the person who's not infected should only come near you and then wash their hands and try not to come near you. Ideally in a separate bedroom if possible, because you will transmit viruses very easily in close proximity to each other.
Now, if you do need a mask, it's very hard to find them at this point in time. I've seen on YouTube, you can take a paper towel with a couple of rubber bands and try to rig something up. Does that work?
So again, a person who is sick, you want to block as possible their expulsion of larger droplets of the virus that they have. So theoretically, a barrier is going to be somewhat helpful.
Any kind of a barrier.
But I have no idea whether any of those types of things would work. But it doesn't have to be a fancy mask. It could be almost any mask would somewhat decrease a person who's sick from expelling a large inoculum of virus into the immediate area surrounding them. But if you're more than 6 feet away, it probably won't be transmitted beyond that immediate radius around the person.
All right, Fortune asks the question, if you think you have some mild symptoms, but you live with someone who might be compromised in an immune compromised situation, should they get tested?
So anybody who's immunocompromised shouldn't be around anybody who's sick. And sometimes we tell immunocompromised people who are severely immunocompromised, they had a bone marrow transplant, they don't have an immune system, they have some very serious medications that they're taking that really knock out their immune system to treat their underlying disease. So they may be supposed to be wearing a mask, depending on what their physician has told them, to prevent them from being exposed to other people. Certainly, if a person in their house has any respiratory symptoms, they're contagious. And the most mild of viruses can unfortunately be fatal to a severely immunocompromised patient. We keep those patients in the hospital after they get their bone marrow transplant on very strict isolation. That's to protect them. So the same thing should occur in your house. If somebody's sick in a house with an immunocompromised patient, severely immunocompromised, not that, thank God they're pretty healthy, but they had some mild disease that they're quote, immunocompromised. If you're really immunocompromised, you shouldn't be in the house together with somebody who's sick.
Okay. Catherine asks, what are we doing to keep our employees safe? You mentioned the personal protective equipment. We're testing employees if it's necessary, if they think that they might have been exposed. Any other points we want to make in terms of keeping?
We want everybody to know that we love our employees. We have the best employees here at Mount Sinai South Nassau, and we absolutely want them to be healthy. Not only for we want them to be healthy, we want them to be healthy so they can continue to take care of the community. So we have policies in place, we have sessions to teach the staff how to put on the personal protective equipment, how to take it off, when to use it, under what situations you need this type of equipment, on that type of equipment. So we're making sure that our staff are educated. We have done things differently in the hospital since COVID in terms of how we interact in the hospital. This is a conference room. We haven't had a conference here in 3 weeks. We've stopped all of our conferences in person. We do them all online now. We use various video technologies to have conferences as needed. The doctors need to be giving information. This is a video conference. This is not in everybody in the same room. We normally would have had, if this had not been a contagious disease, we would have had this entire conference center filled up, and we would have had public educational sessions. I had 2 conferences that were scheduled for community lectures this week that we stopped, even though they're about COVID, because they're too dangerous.
So we're taking every possible precaution here to keep our staff safe and, of course, our patients safe
Absolutely.
as well.
Absolutely.
All right, so last question. We want to wrap up. I tested positive for COVID-19. I'm doing everything I'm supposed to do. I'm self-isolating. How do I know when I don't have it anymore? Do I have to get tested again?
So we don't routinely recommend that everybody get retested. Depending on the case, that's something you and your physician should be discussing. As a very general guideline, once a person has no more symptoms for 3 days, no more fever, and they're not taking Tylenol to suppress that fever, if somebody has no longer symptoms for a 72-hour period of time, and it's been more than 7 days since they started having symptoms, again, a little complicated there, so you're at least 7 days out from the start of your symptoms, and you're now symptom-free for at least 3 days, you probably are no longer considered contagious. Can I state that with a fact? No, those are the best Department of Health guidelines that we're following at this point in time.
Okay. As we wrap up, any other advice for our Facebook audience and the public in general? How are we going to get through this?
So I think we will get through this. Everybody has to understand that this is something that we have faced, albeit not as much, but we've faced this recently with H1N1 a few years ago. We've had concerns with Zika. We've had concerns with Ebola. This is not something that we're not somewhat familiar with. Every pandemic is different. Every situation is a little bit different. This one is quite different. This one has caused us to make dramatic changes in our life. And that's the message from today. The most important message from today is that you can't say business as usual. And unfortunately, this has killed the economy. This has had a tremendous impact on businesses that had to close. This has had an impact on the workers in those businesses that aren't employed and don't have cash coming in. This has been a dramatic change in the way we are conducting our lives. But it will be a temporary one if everybody truly understands social distancing. If everybody does everything that they can do, that will maybe make that peak not so high in 45 days. Maybe that make that peak not 45 days. Maybe that will make a couple of extra people not have to go on a respirator. A couple of less people getting contagious and spreading the illness. I recommend strongly that people not get together with family from out of town and mix different communities. That's a very dangerous thing to do coming up on the holidays. We have to rethink how we're going to spend those holidays together. They're big opportunities for families to get together. So if your family is living all together in one apartment, in one house, have the biggest party you want for all those people. Celebrate. Continue all your traditions. But maybe this year we have to say, we're not inviting Aunt Sadie to come to the house as well, who lives in a different community with her family and is going to potentially bring illness from her community, or you're going to bring illness from your community to her community, and certainly to her family and to all of the contacts that they have to have, even though they may be practicing social distancing as well. That's the most important message. We will get through this. We'll hopefully get through this with the most minimal loss of life. And that's up to everybody listening, and to spread the word, and to not accept invitations to your friends' houses and say, no, this isn't the time to get together in your living room. Let's get together on some sort of a group chat. Let's get together in some other technologically acceptable way that the only virus you'll get will be in your computer and not in your body.
Dr. Glatt, thank you very much. Thank you for watching, and we'll do this again. Okay, thank you.